All right, guys, we're back. The geriatrics. This is part 2 of 5. Let's talk about assessing these guys and ladies. Again, when we're doing our general assessment of these folks, again, the living situation, the level activity, all these questions that are up here are bulleted out. We need to ask about that. Again, are we going to these folks at 3 o'clock in the morning because they slept all day long? What is their level of independence? I think what supports do they have around them? Okay, what is their nutrition? Do they have any breathing problems or respiratory problems? Abdominal pain, nausea, vomiting. What is their dental care status? Again, any medical problems that we need, and especially when they're compounding medical problems, diabetes along with high blood pressure, along with a cardiac condition, you can pretty much bet they're all going to be on meds. Again, your medications, alcohol, drug abuse. Again, you need to, what is their socioeconomic issues? Are they living literally in a very small area with very little? It appears that it's very, very poorly upkept. The byproducts of malnutrition, they don't get vitamins. They can get easily dehydrated. Their sugar can drop through the roof. So again, chief complaint. Sometimes that might be a little tricky to get. Well, I don't know. I just feel bad. You might have to dig a little bit in order to find that. And again, slow down. As long as they're not in a life-threatening situation, slow down and start your communication process. Can we put on all of our monitoring devices? Of course we can. But we can sit there and talk and communicate with the patient. And you want to make sure that the patient doesn't have a life-threatening issue right away. Okay, is there something that's that's causing this issue that we can work out with them? Okay, because sometimes they might not even be aware that they have a problem actually. Don't be afraid to spend a little bit more time with these folks to talk to them and go. And again, be respectful. Be honest. You treat your elders with respect. You'll be surprised how much farther that can go. Again, they have conditions that can reduce their, blindness, cataracts. Again, same thing with the hearing impaired. Most of them almost always have hearing impaired problems. But again, the cataracts on top of the lens, they just can't see. Okay, or it's very cloudy. Again, if they're hearing loss is a big thing with the elderly population. You might have to speak up, but don't shout at the patient. Okay. Again, if they have deafness, make sure that it's an actual pre-existing condition. Again, they may have trouble with speech or retrieving words. Okay, they may have trouble communicating with you. Get down to the eye level. Talk to the patient. Again, discuss with them what's going on. Go slow, okay? Let them assimilate the information, okay? If they've got hearing aids or eyeglasses, find them. Help them put them on, okay? Turn on the room lights, okay? And again, remember, politeness goes a long way with making sure that. Explain what you're doing and why, just like you would do with a child. The older folks, you might want to explain what exactly is going on. And again, observe and recognize anxiety during the telling of the history, especially if there's some confusion, if there's some things aren't making sense when they tell you that. And again, remember, your mental status will change potentially, especially if they're hypoxic, hypoglycemic. They've got neurological conditions. Okay, so you could get a range of mental status changes with these folks. Okay, and again, just remember, it might be some of the underlying medical problems that are causing this disorientation. Just don't assume that they're senile. Okay, that's a really bad. Assume that it's a medical condition until proven otherwise. But all of these things could cause a mental status change. Okay, every one of them, and they didn't call you because of that. They might not even have this identified as to what is actually causing the problem. So again, start eliminating the ones, start asking your questions, and start eliminating some of these that might be, or worse yet, you got a combination effect. They have a decreased blood volume because their sugars messed up, and they took too much insulin, which dropped there because they had an infection, and oh yeah, they just changed their heart medication. Well, that makes our job simple, doesn't it? So again, By the way, our depressed patients, usually they don't eat. They therefore are dehydrated. Again, they can overdose. They can complain of suicide. And by the way, elderly suicide is a very common thing in the United States, and it's one of the bigger causes of death. Okay, and yes, when they decide that it's their time to, they don't have no qualms about doing it. And again, check for signs of abuse or neglect. Look for medical alert tags, and remember that these patients they don't usually tolerate a long exam. Okay, what I mean by that is the physical exam part of it. Usually, if they sit there and you're communicating with them and you got good communication, but at some point they might hit the wall and go, you know what, I'm just not going to talk to you no more. It does happen sometimes. Don't be afraid to a tag team approach to taking to trying to get a history from this. It may take 3 or 4 people getting a history in order to figure out what's going on. All right. And by the way, they like to wear lots of clothes because again, decrease circulation, decrease thermal control. They always feel cold, so that's why that. And they may minimize or deny symptoms. And again, and the chronic diseases from the acute problem is kind of a challenge with these folks. All right. Again, uh, again, figure out what's going on with the patient is basically what this slide says. Okay. And again, emotional support also comes into play when we're dealing with these patients. And by the way, don't trivialize their fears. Let them express it. Let them, again, and you might have somebody who's having active chest pain, but they are adamant that they're not going to leave their house. Discuss it with them. And explain the dangers of doing it, okay? And it's genuine fears that these folks, they don't want to leave their house because they're afraid they're going to lose it, okay? That is a genuine thing. It is definitely in play. Um, as aging continues to go on with these patients, every system in the body it affects, and it increases the probability of getting disease to those areas. Okay, so remember, you got a decreased chest wall compliance in their respiratory system. The lungs don't move like they used to. They air trap. They the muscles aren't as strong. Okay, the nervous system controls aren't as strong. They lose 50% of their vital capacity by the age of 65. That's again half of how much you're normally used to exchanging gas. They get short of breath really quick, especially when they exert themselves. Okay, so if you've got somebody who's respiratory compromised and they're using a lot of muscles to exert, they're even worse off at that point. Okay. Again, you might have a kyphotic patient, so positioning is important. Okay, you don't want to position this patient where flat on their back because number one, they're probably not going to like it. Number two, they're probably not going to tolerate it. Okay, if they've had chronic exposure to pollutants, black lung patients in particular, long-term cigarette smoking. Again, make sure you position them sitting up where they're breathing the easiest. Okay, use your bronchodilators as needed and an O2 to correct any of your hypoxia. Remember, they can go from okay to not okay pretty quick, all right? Make sure that you're monitoring their cardiovascular status, especially if they're having a respiratory complaint. Remember, those two systems are very tightly interconnected, okay? And with our IV fluids, this is where you want to be kind of careful, actually, I think. Remember, their vessels don't respond like the younger person's blood vessels do. So use your fluid, again, always reassess. Again, where I would say give them 500 of saline and then check them. For the older patients, I would say 250 and reassess is a really good idea. Okay. Again, the cardiovascular system, these guys, boy, lots of things can affect this, okay? And if they've done a lot of these, their probably circulatory system is going to be shot as they get older, okay? Hypertrophy, the left wall, it thickens and it enlarges. Again, usually a sign of, the problem with hypertrophy is that eventually the muscle starts to fail, okay? The fibrosis develops in the heart and peripheral vascular system, and the cardiac function, again, the aorta starts to become stiff. It starts to lengthen. It also, the vessels themselves can start to stiffen out. The atherosclerotic heart disease or atherosclerotic disease throughout the body, okay? And your stroke volume declines, okay? So remember that stroke volume times heart rate equals cardiac output. Well, your heart doesn't pump as much as you get older, okay? So again, the heart's ability to respond to stress, by the way, diminishes, and heaven forbid if they're on a medicine like a beta blocker, where, yeah, that's right, it decreases force of contraction and decreases the heart rate. So again, they don't compensate very well, okay? That coupled with the vessels not moving the way they're supposed to. Medications, they vary with the complaints, okay? So again, you really need to take a good look at what they're taking, and again, writing down all these meds or taking them with you to the hospital is so very important. Or better yet, let a family member take them to the hospital, okay? Because that way you don't have to worry about the chain of custody with those guys. But the key thing is getting that list of medicines to the physician so that they can take a look at what's going on. I can't stress that point enough, and how very important that is, okay? If you've got a patient with any, pretty much you guys I have beaten into your skulls. If it's from the tip of the head to past the groin, you should be getting a 12 lead, okay? And again, they actually are a little scared, but one of the things I will sit there and tell them is no, we're just going to make sure to check their heart to make sure that it is okay, okay? If they're especially if they have a weird, vague complaint, 12 lead is most definitely warranted in this case. All right. The nerve cells, remember, they start to slow down. Yeah, you're going to get some forgetfulness. You're going to get some memory changes with this. Okay. Again, there's a decreased reaction time with these folks. Okay. They just can't move the way that they used to. Try to determine their baseline. If you go to a nursing home, yeah, you can determine a baseline. Usually it's the CNA that takes care of them all the time is your best person to ask. Not the nurse that's in charge of 70 patients, okay? Ask the one that takes care of them on a day-to-day basis. Hey, what's their normal, okay? And because it's our favorite complaint in a nursing home, by the way, is well, the patient's got a decreased mental status, or a change in mentation. Okay, well, what is normal? And now, what has changed? What have you noticed? And don't ask them what's their normal Glasgow. You might as well be asking them what color white's on the wall. Okay. Again, you need to ask them very specific questions about what's going on. And usually, by the way, a mentation change. Again, start thinking that altered mental status and all of those things that can cause that. All right. Again, obviously, we want to make sure that the patient's not hypoxic. Obviously, again, your O2 stats can help there. The endocrine system, again, diabetes is very common, and it's usually type 2 diabetes, but you can have your type 1s, by the way. Again, check their blood sugar. Okay. As a matter of fact, usually an infectious process will send the sugar through the roof, versus if they've been not eating like they're supposed to, yeah, that's probably going to be in the toilet. Okay. By the way, you can have thyroid disease as they age, and they increase, and then they just don't produce the thyroxine like they used to do maybe 30, 40 years ago. Okay. And they can watch out for the blood pressure swings, because again, hormonal control can actually do that. GI, again, you want to make sure that because the volume of saliva and the gastric secretions, they decrease, which means that destroys the gastric motility, and again, they quit moving and they quit producing the acid in the stomach. The gums will actually they start to shrink back, and the taste buds kind of go away at that point. They do have a difficult time tasting. All right, they got diminished liver functions along with this, and hiatal hernias for an older person is actually a really bad thing, because you got the food that are going up into the chest cavity area, producing a lot of chest pain with that, or abdominal pain, upper abdominal pain in that case. Old people are cold. You want to be a great caregiver in the field. I'm about to give you the secret to EMS life forever. Okay. The old person, and they say that they're cold, put a blanket on them, cover them up. You would be surprised how much that does for patient care. It is absolutely scary. Okay. When I was doing Shan's care, man, it was like the first thing we did was we stopped at the blanket warmer. because when we went to go transport these patients, we'd bundle them up, and it was like the greatest thing ever. And we made sure that they were very comfortable. If they didn't need the blanket, you know what? Hey, we got it right back here. And I would say probably about halfway through the transfer, they'd be going, "I'm cold." Hey, guess what? I got the thing for you right here. Guys, that you would be so shocked about how that blanket just does really wonderful things. Okay. Integumentary system. If you guys have tried to start an IV on an older person, you kind of know that, yeah, that makes things kind of fun, doesn't it? And again, usually their vasculature is not that great anyway. So make sure that, again, take a good look. Go for the veins, and remember that these veins can also be a little bit harder. And so gentleness and good targeting is almost essential for these folks. They actually lose 2 to 3 inches of height as they get older. And that's due to osteoporosis. And they also start to lose muscle mass as well. Okay. And again, supply supplemental oxygen is needed. Again, let your pulse oximetry kind of control that. And again, knowing what medicines that they're on can also kind of give us an idea of what it is that's causing problems with this patient. Okay. The renal system, kidneys kind of wear out. All right. Oxygenation, make sure their fluid status is good. If they've got good kidneys to start with, which is probably not too many of your patients, remember the kidneys are the first thing to kind of go, the first things to fail when they have a problem. The other thing is though they are kind of prone to getting urinary tract infections, and then they get septic. Okay, and the frequent need to urinate because again they can't hold as much urine as they used to. There's some atrophy of the bladder. So I guess the favorite phrase as soon as you get in the back of the truck, "I gotta pee." Yeah, well, guess what? There's a true reason for it. Okay, your immune system, yes, they lose the functioning of the T cells, but again, but they are usually able to fight off infections unless there is some sort of immunocompromised issue with them. But again, and usually that's the other problem is the immune system. Again, they get septic, and they start having additional issues along with the inflammation process. Again, you do lose a little bit of red blood cells with this. Again, they increase the thrombolytic events, by the way. So yeah, you are a little bit more prone to having a clot, but the blood volume actually decreases. So you really got to make sure. And the problem is you really can't stop this deterioration. Okay. So they lose a little bit of blood as they get older. All right. Which again, if you stop and think about it, along with they wonder why they're getting weak and dizzy. Well, here you go. You've lost cardiac output. You've lost some of your red blood cells. Oh yeah, you lost 50% of your vital capacity volume. Yeah, I wonder why they're feeling weak and dizzy. Okay, so we're going to start on the pulmonary problems on the next one, and I will see you guys on the next video.